Welcome back to the KSAT News at 9, fighting fear with facts. It's what we're attempting to do every night during this pandemic at around this time on KSAT News at 9. Tonight, we're joined by Mayor Ron Nirenberg. Thank you for joining us, Mayor, from the comforts of your own home. I don't know that, I get the T-shirt on, just nice and relaxed. So I appreciate you taking time out from your night.
Thanks for having me on, Steve.
The first question that we have tonight is from viewers, actually. Workers at Southeast Nursing and Rehabilitation Center who've been tested and are awaiting results. Are they being told to self-quarantine or are they continuing to work?
Yeah, no, any of the workers that have been exposed to positive cases or even suspected of are isolating at this point.
Next question, is there any assistance being offered for people who can't pay rent or pay their mortgages due to the pandemic? And I actually know some of the mortgage companies and some of the credit card companies and people like that are giving people some leeway in this. I didn't know if the city or the county is doing anything in particular.
Yeah, well, we've been working on this since really it all began. And so a couple things are happening. Disconnects of utilities there's a moratorium on those from SAWS and CPS, and there's a moratorium throughout the county on any evictions, whether they're SAHA public properties or they're private properties. No one will be foreclosed or evicted during this period of time, and that includes business tenants as well. Of course, that doesn't mean that bills don't still come in, and that's something that we're working through with the various relief funds that we have available, the risk mitigation fund of the city, but also it requires some state and federal intervention. And I know there's some things in the works. Unfortunately, we don't have the authority to rewrite contracts that are done between private parties, but we are working on various relief efforts so that when this period is over and we go back to some normalcy, that all of that back payment and rents that are in arrears don't all of a sudden start to push people out on the streets. We certainly wouldn't want that.
Yeah, no way. Next question, are there any home tests you can take for COVID-19 that are currently on the market?
No, there are not. And unfortunately, as we've seen during any disaster or crisis, there's always those opportunists who are trying to push some snake oil or something like that. And so we've seen a number of those things come through. There are also actually some tests that are being vetted that haven't been approved that may turn out to be okay, but we simply don't have home tests that are available. The tests that are available that are made through private manufacturers that have been vetted and approved and that are rapid, they're actually being all bought by the federal government, FEMA, to make sure that they're distributed to the places that are essentially being triaged right now. And so we want to get our hands on here in San Antonio tests that we can start to move much quicker and do much more wider assessment and quicker assessment. We're working through that. We're vetting some tests through STRAC. But there's nothing available for the private consumer at home at this point. And if you're sold something like that, beware.
Yeah, be aware of the scams that are out there. We talked about that a little bit at 6 o'clock. Okay, a question from Twitter now. This comes from Matson. With California showing some signs of success with their strict stay-at-home order, have you been talking to the governor about doing the same thing in the state of Texas?
We have from the very start, and the good news there is that a couple things. All of the major urban areas, the major population centers of the state of Texas have been working together, and so we all implemented very closely the same type of stay-home order at the same time, pretty much. We've been working in concert to make sure that we have strong measures in place to help slow the spread in the major urban areas. Unfortunately, we only have jurisdiction within our own cities. We have been urging the governor to take a look at what we're doing and implement this statewide because, we know that the virus is going to spread to every corner of the city and we need to all be working together to limit the spread because it moves from place to place. It doesn't know boundaries. And the good news there is that the governor did issue essentially stay-home orders yesterday in defining what an essential business and non-essential business is. It is very closely matched to what we are doing in the cities. There's some variations. We're asking for clarifications on those. But essentially, the whole state now is in some semblance of a very similar stay-at-home order as ours here in San Antonio.
Okay, along the lines of that, I want to ask the next question from Twitter. This is Yolanda. She wants to know, considering how many are blatantly disobeying the stay-home, work-safe order, again, these are Yolanda's words, not mine, are you considering making a curfew and instilling fines for those who are caught?
We've been very clear from the start that the stay-home order is an order. It's not a request, and this is for the health and safety and lives of our neighbors. And so we put in enforcement mechanisms in that, as did the county, and that includes civil penalties. It includes law enforcement if necessary. And we have been taking in violations and making visits to those businesses and establishments that are violating the orders. Some of them, most of them, have come in compliance voluntarily. Just, they pleaded not knowing or something like that, and they've gone strictly into compliance. There have been a few bad actors. There's no doubt about that. And we are issuing citations. In fact, there was a well-documented case on the front page of the paper today, and that person has been cited, and we're going to continue to apply pressure to those who are putting all of our lives at risk by their negligence.
Next Twitter question from Eileen. She says, do the counts include presumed positives or only tested patients? It seems people with symptoms/exposure are being told there are no tests.
So we need to be very clear about that. If you are suspected of having COVID-19 and your provider, your doctor or a nurse or someone on our screening line says that you need to be tested, you will get a test. And it doesn't matter if you have a primary care provider or if you don't have insurance or whatever. If you are suspected of having COVID-19, you're going to get a test. And if that's not happening, call me, because we need to make sure it's happening. But with regard to the counts that you see every day that we provide the public, those are strictly the number of cases are all confirmed positive infections in our community. We do have another count. It's not as it's more fluid, of people who are under investigation, meaning that they are suspected of potentially having the virus and they're being tested right now, but they haven't gotten their test back yet. We expect both of those numbers to go up. And in fact, we are pushing very hard to widen the testing protocol to get those tests that I mentioned down to San Antonio, as every other city is trying to do, so that we can open up testing even more. But at this point, we have a good sense that those numbers are going to rise. But if you are suspected of having COVID-19, we want you to get tested, and we will make sure that you get tested.
Will the stay home, work safe order be extended? It's currently running just to next Thursday, April 9th?
Yeah. Yes. There's very little doubt in my mind we will extend at least through April 30th, which is essentially what the state has done in their order yesterday. But we're going by the strictest health guidance, because the best thing we can do to all get back on our feet and see the economy start to run again is to make sure that we kill this virus, that we slow the spread and get out of these restrictions as quickly as possible. That takes us all working together, but it does mean we're not going to be out of this by April 9th.
Laredo is telling people to wear masks when they go out, even if they don't think they have the virus. Is that something San Antonio is looking at? Have you talked to people about that?
We are looking at that, and we're awaiting some CDC guidance on that. And I, in fact, was just talking with folks on my staff about that literally minutes ago. It seems like a very commonsensical thing to do if you have access to, some face, nose, mouth covering, because we do know that asymptomatic carriers are spreading this virus. That's how it's driven this pandemic. So, protecting yourself and protecting others from you potentially is a good thing to do. We are waiting for from strict guidance, but I will say this: PPE needs to go to frontline health workers and first responders first. Those are the ones that are most at risk. So we want to make sure that we don't compromise any supply of PPE, such as face masks, by unnecessarily putting them in places that they don't need to be. But if it's guidance from the CDC, if our health professionals suggest this is something that we need to implement, we would probably move in that direction if that is the health guidance. But at this point, there's not any.
Okay. Yeah, and PPE, personal protective equipment, for those who aren't
That's
sure
right.
what that acronym means. Final question for you. 9:20 tomorrow morning, you have asked for a moment of silence. Talk about why you came to that decision and what you hope people are thinking during this moment of silence at 9:20.
Well, we're all sort of isolated right now physically, but we're also reminded of the fact that we're all in this together. We're connected to each other, and whether or not lives are saved and we get back to somewhat normalcy depends on us all working together. And we're connected in more ways than one, even while we're in our own homes or wherever. And so in recognition of that solidarity, but also the fact that we're together on this because of the lives lost and the lives that we're potentially saving, I thought it was a good opportunity for us to have a citywide moment of silence. We will be doing that tomorrow at 9:20. I'll probably be doing it every week, frankly, to recognize those who have lost and those who are fighting for their lives and those who are fighting for other people's lives, the healthcare workers, the first responders, the doctors, the nurses. So at 9:20, for a minute, the bells of the San Fernando Cathedral will ring, and we invite you to join us in solidarity with all of our neighbors here in San Antonio, but really across the world.
Mayor Ron Nirenberg, thank you for your time tonight.
Good night, y'all. Take care.
Take care. We'll be right back.